The diagnostic lens is placed on the eye and allowed to settle or equilibrate prior to evaluation. Equilibration for 15 to 30 minutes allows the lens to assume its position on the eye and the reflex tearing to subside. A biomicroscope or slit lamp is required to properly observe the lens on the eye. The lens is evaluated for comfort, vision, corneal coverage, centration, movement with the blink, with the patient looking up, and upon displacement. Corneal coverage should be adequate in all directions. Incomplete coverage can be caused by a too loose or too small lens. Decentration can cause blurred vision and decreased lens comfort. Modern lenses should move up to about a ½ millimeter with the blink. The amount will depend upon the type of lens, material, and manufacturing method. Inadequate movement indicating a tight fit does not allow adequate tear exchange and can cause buildup of debris and metabolic wastes behind the lens. With a tight fit, vision is typically blurred between blinks as the lens lifts off the cornea and clears immediately after blinking. An immobile lens accompanied by conjunctival indentation and blood vessel closure at the lens edge may lead to inflammation, corneal neovascularization, and acute red eye reaction. Conversely, a too loose lens is characterized by excessive movement, decreased comfort, blurred vision, and decentration. With a loose fit, vision is typically clear between blinks and blurred immediately after blinking. With the patient looking upwards, the lens should drop or lag slightly. The push-up test can be used to supplement movement observations. The practitioner pushes the lens upward with the patient's lower eyelid. The lens should move easily and return smoothly to its original location. A tightly fitting lens will be difficult to displace from the cornea. A loose-fitting lens will be displaced easily and may not return to its original location. Some initial awareness of the lens by the patient is normal, but the lens should not cause discomfort. It is important to note that comfort does not necessarily correspond to a good lens fit, as tight lenses are initially comfortable. The lens power is refined by performing an over-refraction. This is a refraction done over the contact lenses to determine the final power. For example, if the over-refraction result is plus 0.5 diopters and the diagnostic lens is minus 2 diopters, the resulting lens power should be minus 1.5 diopters. If the first diagnostic lens does not provide an adequate fit, an alternative lens with a different base curve or diameter is chosen. To tighten a loose fit, a lens with a steeper base curve radius or larger diameter should be chosen. To loosen a tight fit, a lens with a flatter base curve radius or a smaller diameter should be chosen. To alter the fit even more, both the base curve and diameter could be changed. In review, the characteristics of a well-fitted soft lens include: the cornea is completely covered by the lens. The lens is centered about the limbus. Lens movement up to about 1/2 millimeter. There is adequate lens lag. The lens moves readily with the push-up test and returns quickly to its original position. The patient reports a good comfort response, and the patient has stable visual acuity with an over-refraction. If the diagnostic lenses meet the criteria of a well-fitted soft lens, the practitioner may proceed to dispense or order the prescription lenses. A successful fitting results in the patient proceeding with contact lenses. They will be taught how to insert, remove, wear, and care for their lenses before they are finally supplied. Patients are required to attend regular follow-up appointments to ensure the ongoing health of their eyes during contact lens wear. The design and fitting of contact lenses involve a complex interplay between the lens design geometry and the requirements of ocular anatomy and physiology. Today's contact lenses are available in a wide array of materials, designs, tints, and wearing options, allowing the practitioner to tailor fittings to the patient's individual requirements.